Dr. Roger Smith is joining me right now talking about burnout and the fact that it is a constant threat for OB-GYNs. And really, they are among the highest on the list.
Yes, consistently OB-GYNs have burnout rates of 45 to 55% or higher, depending on the study. It's a real problem.
And this is not just in practice, this is even for residents.
The rate of burnout is actually even higher for learners, in part because of the intensity of the demands placed on them. Sleep deprivation, the problems of trying to balance work and home life and still study. Residents are at a much higher rate. It tends to be the highest in the first year as they're transitioning, and then it does get better as they go further along and develop a little more professional sort of confidence and autonomy. But it's a big problem even after you get out in practice.
And I don't think we can really talk about a problem unless we outline some of the results of it, and people, wanting to quit their jobs and saying that they wouldn't even go back into medicine again if they were given the choice and could rewind.
Number of studies have consistently showed exactly that. The ACOG did a study of District 3, I think it was, and 16% of those who responded were seriously considering giving up their practice at that point, and 40% said they might not choose medicine again as a career choice. That's scary.
So what can be done?
Well, I think the things that make sense to do are to be aware of the threat, be sensitive to the fact that stress is everywhere. In fact, stress can even be good. Too little stress and we rust out. But what we have to watch for is what's often referred to as toxic stress, when there are strong demands but very little control. So we have to watch for the possibility of burnout, be aware that it's there, and then do things to pay ourselves back, to relax, to do things that will harden us against those threats so that we can be there for our families and for our patients.
What do you think the symptoms, if you will, are of someone who is beginning to get that feeling of burnout?
Early on, the symptoms are very nebulous. They're fatigue, a sense of loss of purpose, that you just didn't accomplish anything today. As you move further along the scale of burnout, you're more likely to see signs where you just don't want to go to work, you don't bounce back normally, you're starting to see depersonalization, cynicism, you put off tasks, you don't complete medical records, you stop responding to pagers as promptly as you did, and late in the process it can become toxic to the individual and to families.
Is there a plan that physicians can put into place to try to make sure that they're taking time for themselves every day or every week?
Well, it's an easy thing to say, but everybody's busy and it's very hard to try and find time. But sometimes as little as a 10-minute break can make a difference. There have been studies that have shown that if you just take a break, breathe, laugh, sing, do something to pay yourself back. Remember that you have a family and don't take home homework if you don't have to. Get help with tasks. Get carry out, whatever it may be. Those little things can often be the emotional weekend or break that's needed to try and ward off the symptoms and the sequelae of burnout.
Now, this is not a new problem, but it truly is coming into focus more now, and I think that can only be positive by physicians talking about it even amongst one another, so they can try to find a solution.
Oh, there's no question. Yes, the risk of burnout's always been there, but as life has become more frenetic, more hectic, more pressures, more threats, more need to multitask, it has become a bigger issue. And probably the best thing that anyone can do is to be aware that it is an issue, be aware that it's a threat to any and all of us, that it's not a sign of weakness, that it's not something that you have to have, it's not necessary to be a good clinician to burn yourself out. You're not going to serve anybody if that happens. So by raising awareness, by being sensitive to it, programs like the clinical seminars here or the resources that the college has on its webpage all can help raise awareness, and by doing that I can then watch for signs and try and head them off when necessary.
Because this is something that's not just detrimental to the physician but their patients as well, and even their own families.
Yes, a number of studies have shown that when burnout's present, for example in residents, the accuracy and the quality of medical records goes down. There are more errors of omission and commission that occur when somebody's burned out or has symptoms of burnout. And at home, these emotions bleed into the family. And it can be obviously detrimental to everyone around you.
So it's critical to talk about it and work together to try to solve it. Doctor, thank you so much.
Thank you.